I'm now going to show you exercises to help you stabilize your lower back. Now, the lower back needs to be extremely stable when you're contracting. Okay? When you're lifting something, when you're bending, even when you're just standing straight, you need to contract them a little. But the more you lift your arms, the more you bend forward, the more you grab something heavy in your hands, you need to contract these muscles so that they stabilize your joints. Now, if they don't contract, well then that's when your passive structures, so your ligaments, your discs, they'll take a lot more of the pressure. So you need to be able to stabilize. Now, there's certain tools that can be used when you're in a situation that you're not used to being in. So if you're going to move someone, well, it can be a good idea if you're going to start lifting pianos and stuff, that if you start to get a bit tired, that you use a kind of strap, a kind of belt that stabilizes your lower back. But only in those cases, or if your back is really out and it's too spasmed, you can use those two to give you a hand. But you need to strengthen them as fast as possible, as soon as possible, so that you can stabilize your lower back and you're not going to injure it and you can use it more. So these muscles are the oblique muscles, oblique externus, internal, and the transverse of the abdomen. So these muscles need to contract so that when you stabilize, when you're forcing, that you're not going to hurt your back. Now, the exercise I'm going to ask you to do, you can do 4 reps of about 30 seconds. If you can only get to 10 seconds, well then fine, just maybe do it a bit more often than 4, maybe do 8 if you can only get to 15 seconds, or depending on how much you can do without having any pain. So if something starts to hurt, try to warm up a bit more, try to massage it with the ball. But if it's painful and it doesn't want to go away, and every time you try to do the exercise it hurts, well you're just not ready to do that exercise. So 4 times 30 seconds should be fine with most of these exercises. You can vary that as long as you're not changing the form while you're doing it. So if you're starting to arch your back, stop. If you're starting to feel any pain, stop. So the point is to be able to do it as long as possible without any pain and without changing to a bad form. Okay? So first thing is doing the plank. So the easier way to do the plank is to do it on your knees, with your arms like that. And then to make it a bit more difficult, you can go on your elbows. And to make it more difficult, well, then you go back on your hands and go on your feet. And when that's a bit too easy, you can also go on your elbows again. There are also more variants that are more difficult, 1 leg at a time and things like that. But the point is, you don't want your lower back to start arching. So if it starts going down, you stop. Alright, so next up, that was the plank. Now the side plank. Side plank is a very important exercise. It can be a bit harder on the shoulders, so I'll show you a variant with the exercise ball. So same thing, same logic. You start with the side plank on your hand and on your knees, and when that gets easier, you go on your elbow, and when that gets easier, you go to your hand and your feet, and then your elbow and your feet. And there are other variants where you can lift your leg and do all kinds of things. The important thing is that you're contracting and it's not hurting. Now, this is definitely one of the more difficult exercises, and that can definitely cause you pain on your ribs or in your lower back. So if it starts to be painful whatsoever, you stop. If you start curving, you stop also. Okay, so that's a very effective exercise, but it can be a bit riskier, so be careful. The next one that you do on the floor is the bird dog, or the Superman, Superwoman, whatever you want to call it. The point is here is that you lift your leg, and people tend to do a series of that, and when you do too many, they start to extend the lower back, to arch the lower back. We don't want that. What you need to do, you can even, as long as you're lifting the leg, that works, but you can put it straight. Always bring in your umbilical towards your spine, and you just lift the leg, and you lift your opposite arm. And it's even working your neck. So the side plank was working the side of your neck, and the Superman is working more the back. The plank also was using the back. So here lifting the shoulder at the same time. The point is to keep your back straight, and if you start arching, you stop. Now, if it's hard on your wrist, go on your fist. And to make it harder and harder, you can bring your fist towards your knee, and you have to stabilize a lot more, not to lose your balance. Okay, so that's very effective exercise. Also, not as hard and not as painful usually as the side plank, but very different, so it's good to do both. Now, using the exercise ball, you remove the possible injury to the shoulder and the thoracic spine, so and then the ribs. So first thing here is you can do instead of the plank, you can just do a kind of crunch. So you're kind of just on the ball and you're rolling forward like that. And the point is to contract your abdominal muscles. You can keep your hands low. You can slowly bring them higher and higher. And the higher you bring them, the harder it is. So you can start a bit higher up like that. That's definitely easier. And the lower you go, the more difficult it is. And to make it easier, you can also go on your back like that. And the harder you want it, the more you go towards your pelvis. So that's again to work more of the abdominal muscles, and you can do it up to 30 seconds, like I was saying, 4 times 30, or as long as it's not hurting. The next one is, instead of doing the side plank, is doing the exercise here with the ball. So you roll towards the wall slowly, and you make sure that you're used to the ball and you're not going to start falling. Really, really important. And you put both legs open against the wall, and you kind of just lean to the side here. Now, if you keep your arms down, it's easier. If you bring them up, it's harder. And the point is, you don't want any pain here because it's contracting here. On contrary to doing the side plank, where it's contracting on the bottom part. Now, since you're leaning and you're contracting up, well then this side is contracting and you're making sure it's not painful at all. If it's painful, stop, massage, use a roller, use a ball, make sure that it's well warmed up. So, if it's too painful and nothing helps, well, it just means you're not ready to start doing those exercises. And that one with the ball should be, a lot easier on the shoulder since you're not putting pressure on that joint. So those are 2 exercises with the ball, 3 with the floor. Very easy to do, simple to do. Just make sure they're not causing you pain. And the more you can do them, the stronger your lower back will be and the safer it will be also. So here you go.